Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith Rogers. Today, Stephanie Desmond talks to Dr. Helene Hedian, a primary care physician and director of clinical education at the Johns Hopkins Center for Transgender and Gender Expansive Health, about what feels like a legislative assault on transgender rights in the U.S. and the importance of gender-affirming care for mental and physical health. Let's listen.
Helene Hedian, thanks so much for joining me.
Thank you. I'm happy to be here.
Today, I wanted to talk to you about really being seen as an assault on transgender rights. A Washington Post analysis found that since the beginning of the year, more bills targeting LGBTQ plus rights, particularly transgender rights, have been introduced and become law than any other time in U.S. history. Does that ring true to you?
It does, unfortunately. It's a reality that I talk with my patients about every day when I see them in clinic. It's felt very heavily by members of the LGBTQ community because many of them don't have the luxury of tuning out politics when it directly impacts their lives, their families, and their livelihoods and their health.
So what do these mean? What kind of, first of all, could you tell us a little bit about what kind of laws we're seeing?
It's a wide range of legislative attempts to restrict the freedoms and healthcare access of LGBTQ people. In some cases, laws are targeting healthcare for minors, particularly for trans and gender diverse minors. In other cases, they target the right of trans people simply to exist safely in public spaces. I have a patient who's from out of state who had to tell her family recently that she can't go back and visit safely because that state has passed a law, which means that if she were to get pulled over for like a routine traffic stop, she could be arrested because the sex on her ID doesn't match sex on her birth certificate. Really invasive, life-changing things are being put into law that aren't really based in science. And I think that it's unfortunately, people are losing the human aspect and the human perspective on the real personal, real life impact that these laws are having, really, for people across the country.
It seems to me as though there are two different lives to live, right? A blue state or a red state. And it's becoming very clear where transgender people are welcome. It seems like it would have consequences, not just medically, but also emotionally.
It does. And, as a primary care provider, I speak and think a lot about people's health, right? But of course, caring for someone's health doesn't end the moment that they walk out of a doctor's office, right? There's so many aspects and dimensions of health that are preventive in nature, right? Your ability to exercise and to take care of yourself and eat well, go to the grocery store, all of that depends on feeling safe, feeling comfortable in your environment, having people who are supportive around you, not experiencing discrimination and aggression at work or at the grocery store or wherever you exist. And so it is being felt, the ramifications of these legislative attacks are being felt again throughout the community, unfortunately, and having real impact that I see every day.
One particularly startling piece of legislation I saw was in Arkansas, which granted transgender adults 15 years to file a lawsuit against their doctors if you were a minor when you had this done. I'm curious, just from a medical perspective, what that makes you think.
I wasn't familiar with that particular piece of legislation. Can you talk me through, file a lawsuit against their doctor?
Basically suing them for malpractice.
Yeah, that law was not written with the input of any single person of trans experience. I can tell you that right now. It's just tragic.
So I'm curious, sort of medically. I mean, I've seen some of these laws are saying basically, even if you've been getting gender affirming care, that they can no longer provide it to you. Talk me through that sort of medically and physically and what that could impact.
Yeah. So for somebody who's trans, who has been receiving medically necessary care, which can include surgeries or hormone therapy, among other things, to be required to stop hormone therapy, for example, after you've been on it for a long time, can have really devastating medical consequences. Thinking about the opposite of that and caring for a trans patient who starts hormones for the first time, within days, their mental health improves. This is before it's really too early to even see any physical changes, which of course are important and a goal of many people who take hormone therapy. But just that hormone balance makes such a difference in people's mental health and happiness. And so it would be like, removing sort of someone's own hormone producing organs, right? Removing somebody's ovaries or their testicles against their will. Sometimes it's helpful to think about the converse. Like if we were talking about a cisgender population, we would be talking about sterilizing people. That's the equivalent kind of impact that it would be to remove these vital medications from trans folks. Mm-hmm. People might experience hot flashes. They might experience fatigue, mood swings, and all sorts of other symptoms that really don't need to happen, right? And there's no medical reason for those treatments to stop.
It feels as though doctors are not really being consulted on these matters.
I think that's true. Doctors with experience caring for trans patients are not being consulted.
Yes, thank you for clarifying that. Do you, in Maryland, I guess sort of get to look at everything a little differently, right?
Maryland has a very strong advocacy network within the trans community. This year in the legislative session, a bill called the Trans Health Equity Act was passed by both the House of Delegates and the Senate. And we are hopeful that it will be signed by the governor. But that is a bill which expands coverage for Maryland Medicaid recipients who are trans to be able to receive gender-affirming care that many private insurers do cover, and which was previously excluded from Maryland Medicaid recipients. So we are lucky to be in this state, and I'm grateful for the community advocacy and support that has allowed a bill like that to be in the forefront and possibly, hopefully, someday law.
And I'm sure you saw this coming, I guess, in your line of work, but I feel as though the first frontier in all of this sort of discrimination, I think, was for the LGBTQ community. And over the last several decades, it has become poll numbers show that people are very accepting of LGBTQ, and it's sort of a wonderful development, right? And a lot of people are safer now than they've probably ever been. But I guess the T is transgender, and that's the group that's really being targeted here. Why is the parts of the public saying this is okay?
If I understood that, it would be in a very different place.
Do your patients ask you about this? Like, do they ask you about whether they'll always be able to receive the care they're getting and those kinds of things? Are these things weighing on their minds?
Yeah, it is a fear that is ever present.
Mm-hmm.
Absolutely. These are calculations that people make all the time. I mentioned the patient who can't go to her home state anymore and visit her family, right? But that's one of hundreds of examples, right? There is always this fear that it will be, this area next or this thing that I need next. And living under that constant fear of discrimination and of lack of access to care, it has an impact.
I'm sure that obviously we talked about this, it has a mental impact. Even if you're living in a place like Maryland and you're transgender and you keep reading sort of the barrage of things that are happening elsewhere, it can't help but make you worry.
I would agree with that. And it contributes to a well-described phenomenon known as minority stress, which refers to the negative health impacts of larger societal discrimination on a group or on a population.
Are you afraid this trend is going to continue?
That is outside of my control. So I may fear it, but I keep showing up to work every day, and I take care of my patients and try to help them take care of their health and focus on the things that I can control.
These the therapies we've been talking about, hormone therapy, et cetera, those are things that someone receiving gender affirming care really needs. What else do they need that, those of us who are outside of your field might not think of?
I mean, they need everything that a cisgender heterosexual person might need, right? They need the ability to apply for a job and not get discriminated or not get fired when they come out at work as trans. They need the ability to have safe and stable housing. They need access to good, healthy food, right? All of the things that keep all of us healthy are sort of the same. It's just that one group, as you said, is being targeted in particular.
Have your patients said anything to you aside from the extreme example of the person afraid to go to their home state? What are you hearing from your patients?
So some of this I hear from my patients and some of this I just hear from the larger community, but I know of a young gender diverse child whose family moved across the country to be in a safer state because this child was getting ready to start school and was told that based on the local legislation that teachers would not be allowed to refer to this child by their chosen name and by the appropriate pronouns. They would have to dead name and misgender this child. And so the family had to make a decision about what that meant for their family. And ultimately they left the state.
I can't imagine that position. I mean, it's so challenging.
It's challenging. And it's, that family did what was right for them. And I'm grateful they could do that. Not everyone has that luxury to be able to just pick up and move across the country and get a new job and establish oneself somewhere else, somewhere safer. But it is happening.
What do you foresee as the consequences of this sort of thing, all of this discrimination against transgender athletes and healthcare? And I mean, Kansas has a bill that seems to sort of exclude transgender people from public practically. What do you see?
What I hope is that over time, there will be a greater recognition and understanding that trans people, trans identities, gender diversity has existed for a very long time, right? There is this sort of fixation in some parts of our society today on, trans identities being a new thing, on people sort of getting ideas from social media and being influenced in that way, when the truth is trans people have been around as long as there have been people, right? There are historical examples. And it is true that we talk about trans issues, trans rights, trans health more now than we used to. That is true, but it does not mean that it is new. And this is, I mentioned throughout history, but throughout the world, there are numerous examples of gender diverse identities in different cultures, in different languages, sort of outside in this cultural context that we're talking about in the United States. And those terms and identities don't evolve overnight, and they certainly don't evolve as a result of Instagram, right? My hope is that one day there will be a greater recognition and understanding that trans people have been here forever. They are here to stay, and they are a valuable and cherished part of our community.
Mm-hmm. What kind of impact is all this having on mental health?
Negative. Negative one. Yeah, so it is commonly described that people with trans identities have higher rates of suicidal ideation, and that is true. What is less commonly explained is that suicidality is directly linked to experiences of societal discrimination and lack of family and social acceptance. There is nothing intrinsic about being trans that makes people feel suicidal. It is the loss of family and social support, the loss of those support networks and friendships even, that causes people to experience these extremely negative mental health emotions.
Helene Hedian, thank you so much for joining me.
Thank you. It was a pleasure.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.